Go.
Parainfluenza virus by Vanessa Brashears. The parainfluenza virus terms from the prefix para, meaning resembling or abnormal. Influenza, which is otherwise known as the flu, is a serious viral infection of the lungs and airway. Virus, which is a small infectious agent that replicates only inside living cells of an organism. So what is parainfluenza virus? It's a group of multiple viruses that cause an infection in the respiratory system. It was first discovered in the 1950s. It resembles the common cold. Even though it says influenza in the name, it does not resemble the flu. It lasts roughly 1 to 7 days. So it's classified as the realm, which is the Ribovira, the phylum, which is the Narvarcata, the class, which is the Mongivirusites, the order, which is the Mononegavirales, and the family, which is the Paramyxovidae. The viral structure of the parainfluenza virus is about 15,000 nucleotides, which a nucleotide is a nucleoside that's attached to a phosphate. Of all 15,000 nucleotides, there are about 6 key structural proteins. So these proteins that make up the virus are the hemagglutinin neuraminidase, which is HN, which is included in the envelope. So the HN is here, the teal ones on the outside. It is for attachment and for cell entry. The fusion protein, which is also located in the envelope, is for fusion and cell entry. So that is the green in between each teal one here. The matrix protein, which is within the envelope, it's for assembly. So that is the yellow bars here in between each HN and F protein. And then we have the nucleoprotein, the phosphoprotein, and the large protein that are all in the nucleocapsid that form a complex with the RNA complex. So that is here, that's the large protein, the phosphoprotein, and the nucleocapsid right there. So what area of the body is affected? So the respiratory system is affected. It could be either the upper or the lower respiratory tract. So whatever tract affected determines the severity of the virus. So strands of the virus, so we have the HPVI 1, 2, 3, and 4. So HPVI 1 is the most common cause of croup, which is a laryngotracheobronchitis. It's a viral disease of the upper respiratory tract. So that usually goes from 6 to 48 months of age is the normal people that are affected with this HPVI 1. So 75% of children ages 5 or older have antibodies of those from HPVI 1. HPVI 2 is also a form of a cause of croup and other upper and lower respiratory tract infections. But HPVI 1 is still the main cause of croup. HPVI 2 has yearly outbreaks. HPVI 3 is associated with bronchitis and pneumonia. It mainly is affected those who are younger than 1 year old. HPVI 4 remains frequently undetected, so it is so uncommon that it is hard to catch. By the age of 10, majority of children are affected by this infection. This deals with a lot with asymptomatic infections. So what is it? It's a group of enveloped negative single-stranded RNA virus that causes a disease or infection in the respiratory system. Who are most at risk? So infants and young children. By the age of 5, over 60% of children are affected by this parainfluenza virus. Elderly, because their immune system, also like infant and young children, their immune systems are weakened compared to others. People who do have weakened immune systems, not just necessarily the elderly or the young, are at risk. Although it's mostly found in humans, it can also be affected in other animals. So those who have malnutrition or are even have vitamin A deficiencies also are at risk for this parainfluenza virus. So this can cause lower or upper respiratory infections, bronchitis, pneumonia, or croup. So symptoms of the virus are nasocongestion, runny nose, sore throat, coughing, sneezing, fever, or chest pain. So diagnosis can be in many ways. So isolation and detection of the virus in cell cultures. Detection of viral antigens directly in the respiratory tract, or polymerase chain reactions. So transmission of the virus, so direct contact between persons through respiratory secretions or large droplets like mucus or saliva. It's an airborne exposure, so breathing on each other or just being in the air, breathing in the same air as someone that has it, coughing or sneezing, or close contact with each other. So speed of the virus. So parainfluenza viruses multiply very slowly, but the virus spreads from one person to another fairly fast. So an incubation period for the virus is 2 to 6 days. So even though you might not show these symptoms of the virus, you could still have it because it just hasn't shown its symptoms yet. How to avoid getting the virus. So washing your hands regularly. Don't drink or eat after one another, and avoid close contact from each other. Treatment. So parainfluenza virus has to mainly run its course. There is no medications or vaccinations to avoid getting the virus or to completely rid of the virus from your system. You have to eventually take medications just to rid of these symptoms, whether it be fever or the coughing. Try and get rid of it that way. Once you get the virus, it isn't uncommon to get it many more times. It is actually very common to get it more than once. So I would say to wash your hands and to beware of the symptoms and to protect yourself. So that is all I have for the parainfluenza virus. Thank you.